Hi, my name is Tashara English, and the article that I chose for this discussion is Analgesia and Other Causes of Amnesia that Mimic Post-Traumatic Amnesia, a Cohort Study. The purpose of this study explores the administration of drugs such as opiates, which is linked to analgesia and the possible effects it has on post-traumatic amnesia in orthopedic patients following injury. In medicine, analgesia is a neurologic state or a pharmacologically induced state where a painful stimulus is mitigated in part or in full. The patients chosen for this study have not suffered a traumatic brain injury that would normally constitute for the amnesia. The study also explores the possibility of other contributing factors such as demographic and psychological variables. An analysis of the research methodology used. Phase 1 was initiated shortly after the admission to the hospital, with recordings of medical, demographic, and psychological data and the type and dosage of medication administered to 63 orthopedic patients. Patients were also assessed for contributing factors such as PTSD, anxiety, and depression. Phase 2 was the follow-up of the data that was obtained from 41 of the 63 patients, about 9 weeks following the initial injury. Psychological data, mood, and post-traumatic stress disorder were again obtained. Also, a retrospective assessment of post-traumatic amnesia using the Rivermead Post-Traumatic Amnesia Protocol. Phase 2 also indicated potential predictors. The predictors included administration of opiates early in the hospital, the total amount of opiates administered early in the hospital, undergoing surgery early on admission, presence of PTSD at recruitment, presence of depression at recruitment, age, and presence of anxiety at recruitment. The 3 interaction terms were also included: opiates and age, opiates and surgery, and age and surgery. Independent and dependent variables. The independent variables are the nature of injuries and no traumatic brain injury. The dependent variables are the predisposition of psychological conditions such as PTSD, anxiety, and depression, and the receipt of opiates, type and dosage of other medications, and the effect of analgesia. Study design. The study design consisted of 63 patients, all of working age, 45 females, 18 males with the mean age of 41.4 years, were admitted to the orthopedic trauma unit with no evidence of brain injury and were recruited for a 2-phase study. The aim of the study is to identify the distinguishing contributing factors of post-traumatic amnesia in non-traumatic brain injured patients. The study takes into account the differentiated variables such as age, administered medication, and possible psychological issues. Explanation of results. At Phase 1, 17 of the cases indicated having anxiety, 18 indicated depression, and 11 indicated PTSD. At Phase 2, the follow-up interviews of the 41 valid cases, 18 reported a suggested inclinations of post-traumatic amnesia ranging from 4 to 96 hours. A logistic regression model including the receipt of opiates, surgery, and anxiety-related variables was significant in predicting this phenomenon and accounted for up to 57.5% of variation in the data. Results suggest that the occurrence of post-traumatic amnesia indicates at least one predictive factor. However, the study provided confirmed that receiving opiates, undergoing surgery, and suffering clinical levels of anxiety at an early stage following injury can lead patients who have not suffered a traumatic brain injury to report a post-traumatic amnesia-like phenomenon at follow-up. The results of the study also suggest that these influential factors may correlate to amnesia in actual brain injury patients. Strengths and weaknesses of the study. Strengths. The strength of the study relies in the reliability of the collected data from both phases 1 and 2, as well as the knowledge and effect of drugs that have sedative effects that induce anterograde and retrograde amnesia, such as benzodiazepines, sedative hypnotics, antipsychotics, and anticholinergics. Weaknesses. Due to the small number of patients that reported amnesia because of other variable-related factors, the initial assessment variables associated with post-traumatic amnesia were proved non-significant, leaving questionable inquiries of overstated severity of their occurrence. Suggestions for how to improve the research design or methodology. One suggestion is opening the study to a larger sample size, which may yield more results. Also, opening the study to patients with early onset conditions such as autobiographical memory loss and confusion, as well as patients with traumatic brain injury by comparing patients whom have a likelihood of amnesia. Assessment data can yield more sequential knowledge that can successfully predict contributing factors of post-traumatic amnesia.